Hello, I am Dr. Parth Bavishi, and today we are going to discuss a very important topic: what to do when you are having difficulty in conceiving. I Am Fine is a very nice initiative by Bayer that provides us with a unique opportunity for patients and doctors to connect with one another, and uh, we can give you all the answers that you want. So today, what we are going to discuss is uh, what what are the common problems that can lead to infertility, what to expect when you are trying, what are the warning signs that there can be a problem, when to seek medical help, common problems and their solution, and what is IUI, IVF, and similar treatments. So this is just going to be an informative talk. I'm not going to give any specific recommendations on treatment or any medicines. And it is no way a substitute for a professional medical opinion. Then the question comes that why this video? If a doctor is going to decide everything, then why to look for this video? But today it is different than what we used to treat. Now it is an era of information and a patient-centric approach. So patient is at heart of everything, and the more informed you are, the more you know the options, more likely you will do a correct decision. Our role, what we love is that when you make a correct decision for yourself and we help you in making that correct decisions. The other thing is that when we talk about treatment for infertility, there are multiple options. And it is not always that a particular option only is suitable for you. There are many options, and you can choose depending on your need, whether you want to conceive fast, whether you want to conceive with minimum medicines, whether you want to conceive in your hometown or you are ready to go to a city. So many things are there, and that is why it is better that you are more informed and then you can make a correct decision. So first, what we are expecting when we are trying to conceive, more popularly known as TTC. So what we make assumptions are based on our limited experience of friends or family, and some will say that my friend tried for the first time and he conceived. Some will say they tried for 5 years and then suddenly they conceived. So there are many misnomers. So it is better that you rely on experience of doctors who have treated many patients, and if in doubt, you can go through the official database of certain bodies like WHO, NIC, CDC, or ICMR. So you have a clear idea that what you can expect. So clearly, infertility doesn't mean when you don't conceive in the first month of trying. What it means is if you are trying without any contraception for a year, and if you don't conceive, then you have infertility. So you need to be cautious and give some time to conceive. If you can't conceive, then we'll talk about what are the warning signs. If that warning signs are there, you can go and consult the doctor. I, as a doctor, receive a call from my friends every few weeks that we are trying for 3 months, 6 months, and I can't get pregnant. What to do next? So I say that, look, these are the warning signs. If you don't have them, just relax and give yourself a time for 1 year. That is if you are younger than 35 years of age. So now, what are these warning signs that may suggest that there is an underlying problem? So first is if you are having difficulty in your sexual relationship, or having any problems keeping regular intercourse because of job, in army, or whatever reason, then that is one of the reasons that can have a problem. Uh, but still, being said, that doesn't mean that you need to have intercourse daily or every alternate day when you are trying to conceive. We'll come to that what is the best time to try. But in general, if you are trying to conceive, the sperm stays alive for 3 days in the female tract, and the egg can be fertilized for 1 hour after ovulation. So twice a week is also sufficient when you are not in a fertile period. Another misconception is that the semen comes out of the vagina after intercourse. So it is normal. It happens to everybody. You don't need to worry about it or try fancy positions for it. It is normal. People who conceive also it happens. People who don't conceive it also happens. Another common warning sign is irregular periods, because the ovarian cycle is such that every month an egg ovulates and regresses, and this leads to a normal menstruation. If the ovulation is disturbed, then only periods are irregular. Irregular periods may be delayed or may be early. So if there is a irregular period, that means there is a problem with the ovarian microenvironment, and maybe the egg count is high, as in PCOS, or there can be low egg count. The other warning sign is that when you have severe pain during periods, then it can be because of endometriosis, adhesions, or any other pathology that can be leading to infertility. So if you have this warning signs, it is better that you consult the doctor early. Otherwise, if you don't have the problems, then you can try for 1 year, and then if you don't conceive, then you can go for medical advice. Now again, here medical advice doesn't mean that treatment. What we focus for the first visit is diagnosis. If first we see that what are the factors causing infertility, if the basic evaluation is normal, then you can still give yourself some time, or you can start treatment. It is your choice, and depending on the condition, we can decide the treatment. So now, when you are trying to conceive, what things you can do to improve your chances of conception? How to boost your natural fertility? So the most important thing is ovulation and the egg that releases. And if you know where your ovulation is, that you can try at that time and maximize your chances of conceiving. Now, ovulation happens around 14th to 15th day in a cycle of 28 to 30 days. But if the cycles are irregular, the ovulation cannot be predicted much. So if your cycles are irregular, you can keep a menstrual calendar and predict the time of ovulation. There are also ovulation kits that are available that you can predict based on that. The best time to try is 3 days before and 1 days after. 1 day after you get the double line. So you are not exactly sure when to do, but at least you know that you are ovulating and you can follow the pattern and improve your chances of getting pregnant. Now, sperm requirement is in millions. So when you are trying to conceive, it is not that the amount of semen is very crucial. as we see that if you have frequent intercourses, the amount of semen is also less, but still the sperm concentration is good. So don't worry about that, and you can try to conceive. You should avoid smoking, alcohol, and any recreational drugs. Also, caffeine intake can also reduce the chances of conception. So you should keep your tea and coffee to less than 2 cups per day, and you can take healthy diet. There is nothing that you should avoid which is healthy. So you can take all the fruits, all the dry fruits. There is no specific recommendation on which fruits or which dry fruits to take. That you can decide. And if you take non-veg food, then you can take fish which have good omega fatty acids, and that can help with ovulatory disorders. You should also keep all your medical conditions in check, like thyroid, diabetes, hypertension, as this can also affect ovulation and your chances of pregnancy. When you are trying to conceive, you can take prenatal vitamins such as folic acid, B12, and vitamin D, which can help with ovarian function. And if you conceive, it can reduce the chances of certain birth defects in the fetus. So it is recommended that you do all this. And now, today's COVID era, what we see is that we frequently find questions whether we should take the vaccine if we are trying to conceive, or we should not take the vaccine. So, as such, the vaccines are safe, but there is no study in pregnant population. But at the same time, if you are trying to conceive, you should take the vaccine. No need to avoid it. Uh, if you get pregnant during that period, there is nothing to worry. You don't need to worry about it. But if you are pregnant and your second dose comes, then at that point we are not very clear as what to do, because still the government has not approved the vaccine for pregnant patients. But still, even one dose is effective. One dose also gives some protection, and that's why we always recommend that if you are getting a vaccine, you should get one. And for the second dose, if you are pregnant, then at that time, what are the recommendations? You check for it and then only go for the second dose. So now we know that what things can be done to improve natural chances, but sometimes we need the help of science, or sometimes we need some changes in our lifestyle also to tackle infertility. So, what are the common problems that are leading to infertility? One is, the most common is the abnormal semen parameters. That is just a manifestation of an underlying disease, but it can be because of reduced sperm count, reduced in sperm motility, reduced in sperm structure, or any other parameters. Well, it may happen because of hormone deficiency, past viral infection, lifestyle, a condition known as varicocele, where there is a dilatation of the veins of the scrotal area leading to temperature disturbances. So this can lead to reduction in sperm count, but more often than not, we cannot find the exact reason why the sperm count is less. If the sperm count is less, and if we find any correctable condition, then it should be treated. But if the sperm count, we can't find the condition, then the empirical treatment is not very effective. But still, we can try some medicines, and if the results are there, you can wait for some time. But for medical treatment, a time limit is must. You may try for 3 months or 6 months, and if you can't get your desired result, then you should stop the treatment. And again, the desired result is pregnancy, not just the improvement in semen count. So if you are not getting the desired result, then it is better to go for advanced techniques. If the male sperm count is severely reduced, in that case, IVF is the only option. And most of the patients with reduced sperm count can conceive with IVF. Even if there is a zero sperm count, there are chances that we can get some sperms for use from the testis. So for male partner, if we have a normal semen examination and a normal physical examination, for most of the basic examination, that is enough. For female partner, the most common condition is PCOS, or sometimes known as PCOS, that can lead to some problems of ovulation. So it is a condition originating from the ovary and affecting whole of the body. And the salient features are that there is infertility, irregular periods, and increase in male pattern hormones that lead to increase in facial hair, some balding, and some other features that increase masculinity is found. Well, there are many small follicles in the ovary, but they cannot achieve, mature, they cannot ovulate, and that is the main problem with the PCOS. So for treatment for PCOS, it can be simple. Uh, Many patients can help from lifestyle modification, reducing weight, and simple oral medications are also effective. Around 50 to 60% of females can conceive with the simple medicines. For the remaining, we may require advanced treatment. The exact opposite of PCOS is low egg count, when the ovaries have very less number of eggs. Now, this is a condition which is often overlooked because we don't feel the symptoms until the advanced stage. The first warning sign in this condition is shorter periods. So if you have shorter cycles, less than 25 days in length, then maybe you might be having poor egg count. And the most common investigation is by AMH test. So AMH test can diagnose if there is any problem with the egg count. And in this condition, particularly better to conceive as fast as possible because it is a progressive condition. And if the egg count reduces very much, then we may require IVF or even sometimes egg from a different person, a donated egg. So, if you have difficulty during menstruation, you feel so much pain during menstruation, it can be because of endometriosis. And endometriosis again is a progressive condition. So you should not ignore severe menstrual pain and get the diagnosis. If there is endometriosis, early treatment is better. Endometriosis has been covered in the past sessions on this page, so you can go through that. Well, my only addition is that if you are planning a surgery for endometriosis, you should check your ovarian egg count. If the egg count is very less, then surgery is a IVF is a better option than surgery in that particular scenario. Apart from this, other common conditions are blockage in the tube, fibroids, adenomyosis, etc. That are many conditions that can affect the growth, affect the chances of conceiving. But by and large, it is better to get your diagnosis done. But don't worry, we have so many treatment options that can help you conceive even in the most difficult situations. So when you are trying to conceive, you need to take care that you don't miss very long years, because if you wait for too long, then the conditions which are there can go to a very advanced stage and reduce your chances of getting pregnant. Now, if we talk about the treatment modalities, what are the treatment that we have? We can have simple medications. We can have IUI, more commonly known as intrauterine insemination, where it is a simple process there. We give some medicines for creating better number and quantity and quality of the eggs. And at the time of ovulation, we prepare the semen sample, separate out the best sperms, and put them inside the uterus. And everything else happens as in nature. The second treatment modality is IVF, or commonly known as test tube baby. The availability and effectiveness of IVF has changed the treatment of fertility considerably. So it is basically a process of fertilization, and it is a process where we fertilize male gamete and female gamete and create an embryo outside the body. And once the embryo is ready, then we put the embryo back inside the uterus. It is a relatively very painless process. Uh, the process is that first we start some injections for creating eggs. Then Under anesthesia, we remove the eggs by a help of a very small needle. Then we take them out, fertilize them, uh, either by conventional IVF, where we put the sperms around the egg, they fertilize the egg naturally, and then the embryo that are created are transferred back. If the sperm count is very less, then we can select the best sperm under microscope and with the help of a needle directly inject the sperm inside the egg to fertilize. So there are many treatment options. Apart from this, there are many advanced techniques in IVF. There are many surgical options as well to help you conceive. So in the end, I would like to say that there are many treatment options. If you choose the right place at the right time and do enough treatment, most likely in 95% of patients can conceive. So don't lose hope. So now we'll take some questions that I see on my screen. First is that I have a son who is 5 year old, and I have a small fibroid. Then you are on some medications. Now, as the medications you are on are basically antihypertensives that are not safe in pregnancy. So first, you need to check with your physician who is treating your blood pressure that you need to change those medications to a normal one, which can be taken during pregnancy. And once that is achieved, then you can plan for pregnancy. Small fibroid is not important at this stage. If you can conceive, then don't worry about the fibroid. But it is also important that what is the location of the fibroid, what is the exact size, and then we can decide. So if the fibroid is coming very much inside the uterus, then even a small fibroid should be removed. And for other fibroids, if it is less than 4 centimeter in size, we can keep it and you can conceive. So fibroid doesn't need to be removed in every patient. So if you find difficulty in conceiving, then we can go ahead and decide what is the what can be done in your case. Right. So there is one more question that a female is asking that her FSH is 1.8 and LH is 0.95 and she wants to conceive. कौन सा ट्रीटमेंट लेना चाहिए? सी आपका जो केस है उसमें इट इज के आपका जो ब्रेन में से हार्मोन आ रहा है वो कम हो रहा है, जिसके कारण आपकी स्त्री बीज दाने के अंदर बीज नहीं बन रहे हैं. तो ये ब्रेन में से हार्मोन कम आने से ऐसा प्रॉब्लम होने के चांसेस होते हैं. ऐसे सिचुएशन में जो ब्रेन में से हार्मोन आते हैं उसे हम सप्लीमेंट कर सकते दे सकते हैं और उसके साथ ट्रीटमेंट कर सकते हैं. ये हार्मोन इंजेक्शंस जो लेने होते हैं वो थोड़े एक्सपेंसिव होते हैं, बहुत ज़्यादा एक्सपेंसिव भी नहीं होते, और आपको उसका डोजेज थोड़ा ज़्यादा लग सकता है क्योंकि नॉर्मल पेशेंट्स में वो हम सप्लीमेंट करते हैं जबकि आप में वो पूरा का पूरा हमें देना है. सो वो अगर आप हार्मोन इंजेक्शंस लेते हैं तो उसके साथ में आप आईयूआई या आईवीएफ ट्रीटमेंट सोच सकते हैं. सो आपका डायग्नोसिस एक बार कंफर्म करना पड़ेगा, बट जिस तरह से आपका रिपोर्ट है आपको पीरियड नहीं आते हैं, ऐसी कंडीशन में ये ट्रीटमेंट से प्रेगनेंसी ठहर सकती है. दूसरा क्वेश्चन है कि मैरिज को 2 साल हुआ है और रिपोर्ट नॉर्मल है फिर भी कंसीव नहीं हो रहा है. सो ऐसा बहुत कॉमनली देखने को मिलता है कि सब रिपोर्ट नॉर्मल है बाद में भी हम कंसीव नहीं कर सकते हैं. तो अराउंड 25% पेशेंट में ऐसा होता है कि कोई ना कोई रीजन से आपको प्रेगनेंसी रहने में डिफिकल्टी हो रही है, बट उसे हम निदान नहीं कर सकते. फर्स्ट ये देखना है कि सारे रिपोर्ट एक्चुअल में हुए हैं या नहीं. तो सारे रिपोर्ट में हम सीमेंट टेस्ट देखेंगे, ट्यूब टेस्ट देखेंगे. ट्यूब टेस्ट बहुत महत्व का है, अगर वो नहीं हुआ है तो वो पहले हमें चेक करना चाहिए. उसके साथ में ओवरी का जो फंक्शन बराबर होता है या नहीं वो सोनोग्राफी में 1 मंथ हम फॉलो करके देखेंगे तो हमें पता चलेगा. अगर इतना सब नॉर्मल है तो फिर आप सिंपल ट्रीटमेंट ऑप्शन स्टार्ट कर सकते हैं. अगर सिंपल ट्रीटमेंट ऑप्शन में आपको रिजल्ट नहीं मिलता है तो फिर हम एडवांस टेस्टिंग करने का सोच सकते हैं, जैसे कि स्पर्म का स्पेशलाइज्ड टेस्ट, डीएनए फ्रेगमेंटेशन कर सकते हैं, लेप्रोहिस्टोस्कोपी सर्जिकल प्रोसेस कर सकते हैं। और आप अगर नेचुरल मेडिसिन से आपको रिजल्ट नहीं मिलता है तो फिर आईयूआई या आईवीएफ ट्राई कर सकते हैं। सो बहुत सारे ट्रीटमेंट ऑप्शंस हैं। और अगर ऐसे पेशेंट जिसमें रिजल्ट क्या एग्जैक्टली रीजन है वो नहीं पता चलता, उनको ट्रीटमेंट से प्रेगनेंसी रहने का चांसेस काफी ज्यादा रहता है। वन क्वेश्चन इज कि आई हैव एंडोमेट्रियोसिस, endometriotic cyst. I have taken all medicines but no results. So now endometriotic cyst जो होती है, it is a condition that affects the ovary. Now it is a surgical problem. So if first line treatment for it is surgery, मेडिकल ट्रीटमेंट इज कॉमनली रिकमेंडेड टू स्टॉप इट्स ग्रोथ। सो अगर आपका क्या दूसरा कंडीशन है, वेदर यू आर ट्राइंग टू कंसीव, यू आर अनमैरिड, you have the children, depending on that we can decide the line of treatment. If you are unmarried, then you can try different medical treatments to delay your surgery. And it is important to monitor the growth of the chocolate cyst. If it is growing more and more in size, then even we have to remove the endometriotic cyst. If you are planning for the baby, as I said, that if you are planning and you have endometriotic cyst, then a small endometriotic cyst should not change our line of management. So you can try for, as I said, for 6 months to a year, and if you don't conceive, then we can check your egg count. If egg count is normal, we can go for surgery, and if the egg count is not okay, then we can go for IVF. Another question is that I have unicornuate uterus. Can I conceive? Yes. So unicornuate uterus में आप प्रेगनेंसी रख सकते हैं। यूनिकॉर्नुएट यूट्रस में जब भी हम कोई भी ट्रीटमेंट करते हैं तो हो सके तो सिंगल प्रेगनेंसी रहे तो अच्छा है। यूनिकॉर्नुएट यूट्रस से आपको प्रेगनेंसी में कॉम्प्लिकेशन के चांसेस ज़्यादा है रादर देन कंसीविंग में। और मोर कॉमनली उसमें ये होता है कि यू गेट सेकेंड ट्राइमेस्टर, मतलब कि 3 to 6 मंथ के बीच में मिसकैरेज होता है या फिर अर्ली डिलीवरी के चांसेस रहता है। बट स्टिल इट इज़ नॉट अ कॉन्ट्राइंडिकेशन। आपको प्रेगनेंसी नहीं करना चाहिए ऐसा नहीं है। अगर इफ़ यू फेस डिफिकल्टीज देन वी कैन ट्राई सम ऑप्शंस, और अगर उसके बाद भी नहीं होता है देन ओनली यू शुड कंसिडर अदर ऑप्शंस। बाकी यूनिकॉर्नुएट यूट्रस में आप प्रेगनेंसी ट्राई कर सकते हैं। The next question is, sir, I have anovulatory cycles every month, but with medication, egg is forming. With decapeptyl HCG injection, egg is releasing. Is it possible for me to conceive without IUI or IVF? Yes. If you can, if you are ovulating with medicines, then you can conceive uh, with without IUI or IVF. So it is not that if you have PCOS you will require this, but still there should be some time limit, because if you try for 6 months, a year, and if you are not getting pregnancy, then it is better that we go for IUI or IVF. Because see, sometimes it happens that ovulation is may not be the only factor, and sometimes it happens that in case of PCOS or different reasons, the egg quality may not be optimum. So we need to take in account different situations also. So you can try for 6 months and or a year, and if you don't conceive, then we should try different options. So we have a follow-up question that about endometriotic cyst, that I am married and I am not able to conceive. My IUI is also failed. So तो उसमें ये है कि जैसे the way we discussed, that if you have endometriotic cyst, it is better to see for the egg count, and discuss with your doctor what is the best treatment option. If your simple treatment has not worked, then it is better that you choose between a laparoscopic removal or an IVF. So that can give you good results, uh, and you can conceive. And when there is endometriosis, it is also important that you keep in mind that this disease is progressive and it can grow further, and it is better you conceive faster. The other advantage is that when you conceive, the pregnancy and the childbirth uh, causes a very positive environment inside the body. So endometriosis is in control for a few months. The growth of endometriosis is suspended. It may regress in size. So it is also better for endometriosis as well as other way to conceive. क्वेश्चन इज, आई एम प्लानिंग फॉर आईवीएफ, और आईवीएफ करने के बाद मेरी बॉडी में चेंजेस आते हैं, क्या चेंजेस आएंगे और व्हाट आर द साइड इफेक्ट्स? सो आईवीएफ के साइड इफेक्ट्स में देयर इज नो लॉन्ग टर्म साइड इफेक्ट्स फर्स्ट, तो ऐसा कोई लॉन्ग टर्म साइड इफेक्ट नहीं है. शॉर्ट टर्म साइड इफेक्ट ये होता है कि जब हम एग बनाने के लिए इंजेक्शन देते हैं तो ओवरीज बड़ी होती है, तो उसके कारण आपको पेन ऐसा हो सकता है, बट वो अगेन शॉर्ट टर्म होता है, 2-3 दिन में चला जाता है. अगर ऐसा सिचुएशन होता है कि ओवरीज ज़्यादा बड़ी है तो हम उस जो आपके गर्भ है उसको फ्रीज कर सकते हैं, आपको ओवरीज बिल्कुल नॉर्मल हो जाए बाद में ट्रांसफर कर सकते हैं. और दूसरा आईवीएफ का कॉम्प्लिकेशन तो नहीं कह सकते, बट ये रहता है कि स्टैंडर्ड आईवीएफ में 25% ट्विंस के चांस रहते हैं. बट अगर आप चाहते हैं कि आपको ट्विंस नहीं चाहिए, सिंगल ही प्रेगनेंसी चाहिए, तो ऐसा ट्रीटमेंट मॉडिफाई कर सकते हैं जिससे आईवीएफ में अगर आपको प्रेगनेंसी रहेगी तो 100% सिंगल चाइल्ड ही रहेगा. तो इन जनरल कोई भी ट्रीटमेंट का लॉन्ग टर्म साइड इफेक्ट नहीं है. शॉर्ट टर्म साइड इफेक्ट में एक नंबर के कारण ओवरीज बड़ी हो सकती है, बट उसको प्रिडिक्ट भी कर सकते हैं, प्रिवेंट भी कर सकते हैं. अगर होता है तो उसे इजी मैनेज भी कर सकते हैं जिससे आपको कोई ज्यादा रिस्क ना रहे. I think सारे questions आ गए हैं. One is the question from my patient that we are trying for 4 months and we cannot conceive. So for you we have all the details. आपका पर्सनली कॉल पे बात करूंगा कि what is the problem and what a question that low FSH LH hormones में क्या मैं कंसीव कर सकती हूँ विदाउट IUI एंड IVF? सो ये आई थिंक मैंने आंसर कर दिया है कि लो FSH और LH हार्मोन है तो आप कंसीव कर सकते हैं. आपको बीज बनने के लिए इंजेक्शन यूज करने पड़ेंगे, तो ये इंजेक्शंस आपको बीज बनाने के लिए हेल्प करेंगे. ये इंजेक्शंस लेने के बाद अगर आप आईयूआई नहीं करना चाहते तो आप नेचुरली भी ट्राई कर सकते हैं, ऐसा नहीं है कि आप नहीं कर सकते. बट ये इंजेक्शन का ट्रीटमेंट में हम आईयूआई इसलिए सजेस्ट करते हैं कि इंजेक्शन का जो हम हमारा एफर्ट करते हैं, इतने डोज इंजेक्शन के लेते हैं, इतना सोनोग्राफी मॉनिटरिंग करते हैं, इंजेक्शन का जो कॉस्ट है वो हम करते हैं, तो इतना करने के बाद हमें अच्छा रिजल्ट मिले इसलिए हम आईयूआई कंबाइन करने का लिए कहते हैं. बट ऐसा कंपलसरी नहीं है, हम सिर्फ इंजेक्शन से बीज बने ऐसा कर सकते हैं और आप उसके बाद में नेचुरली प्रेगनेंसी ट्राई भी कर सकते हैं.